Hi everyone, Whitney Lowe here, and welcome to another of our Clinical Insights videos, where today we're going to be talking about tendon pathologies. You probably hear commonly about tendinitis as the most common tendon pathology, but there's a couple other names that you might hear like tendinosis or tenosynovitis, and it's important to make a clarification about what these different types of tendon pathologies are and where they're likely to be encountered, because not all tendons are susceptible to each of these different tendon pathologies. So today we're going to talk about what are these different tendon pathologies, and then also a bit about how we can go about treating them, how we can identify them, and what's going to be the most effective way to get results for our clients who have these problems. All right, so let's take a look. So first I want to define what these terms actually mean, and then we'll look at where they're likely to happen and what causes them to occur to the various different tendons in different parts of the body. So the first term, tendinitis, is pretty self-explanatory by its suffix itis. Indicates inflammation of the tendon. Now this term has been used for many years to sort of indicate any common overuse tendon pathology, but interestingly what we found in a lot of the recent research over the last several decades is many of these overuse tendon pathologies don't have an active inflammatory component going on with them, which means they're probably not an inflammatory condition for the most part. Now, there may be some degree of inflammation that's occurring in there, but there's just not an active inflammatory process as the main part of the problem. One of the reasons that's really important is that many of these conditions are treated with anti-inflammatory medications. And if that's the case, that may not be getting at what the real root of the problem is. Another problem is a number of these anti-inflammatory medications can have detrimental effects on the collagen, the integrity of the collagen structure of the tendon over the long term. So some of these anti-inflammatory treatments like corticosteroid injections are actually bad for tendons in the long run. So once it was determined that many of these tendon pathologies aren't really involving an active inflammatory process, the term tendinosis came into popularity a lot more. And tendinosis essentially just means pathology of the tendon. Doesn't really specify exactly what's going on here, but what we've learned is that a lot of these overuse tendon disorders actually involve a breakdown in the collagen matrix or the collagen structure of the tendon itself, and not tearing of individual tendon fibers, which is what many of us learned decades ago. So a tendinosis complaint is one in which we basically say there's some type of pathology in the tendon, and in many cases this pathology is really some degree of breakdown of the overall structural integrity of the collagen that makes up the tendon to begin with. Both of these conditions can have almost identical symptoms, and it's really hard to tell them apart. Just to know that it's really kind of rare to have a true tendinitis that involves fiber tearing of tendons, and we'll look at the biomechanical reasons why that is in just a moment. The third type of tendon pathology is called tenosynovitis, and this is a special type of tendon pathology that only occurs in certain tendons. So those tendons need to be enclosed in a synovial sheath, and the synovial sheath is designed to help reduce friction between the tendon and surrounding structures. But as a result of chronic overuse, there's often sort of an inflammatory condition that develops, or adhesions sometimes develop between the tendon and that surrounding synovial sheath. And as a result, you get a painful irritation in there and a binding of that tendon that causes the restricted range of motion and the pain that an individual is experiencing. And that is called tenosynovitis. Now let's look at a couple of key factors on anatomy and structure about why some of these tendon pathologies appear in certain places and don't appear in others. Now we can look at tendons all over the body and see very different types of tendon attachments. So for example, zoom in here for just a moment. You can see a very large tendon here in the short head of the biceps brachii. And this is a very powerful muscle. It's recruited a great deal, but it's very rare to have an overuse tendon pathology in the short head of the biceps. And that's mainly because the tendon is so large and so strong compared to the force loads that it is required to maintain. Similarly, look at the short little tendon here from pectoralis minor. You almost never see an overuse tendon disorder with pectoralis minor. Number one, because it doesn't do a lot of repetitive motion activity, so that's not the type of thing that would lead to an overuse tendon disorder. Take for a moment some of the other types of tendon structures. Come around here on the back side for just a second. And let's zoom in. Here's another muscle group We have frequent muscle complaints that people have in their rhomboid muscles with chronic muscular tightness in this area, but you almost never hear about rhomboid tendinosis or rhomboid tendinitis. Here's one of the biomechanical reasons why. We've got this muscle here, large and broad muscle, but a tendon, it's not a single individual tendon. It's a whole long stretch of tendon tissue connecting that rhomboid all along the spine here, and also another long stretch connecting it here to the scapula, which means those constant pulling forces are spread out over a pretty wide area and not concentrated in this one area, which tends to lead to the overuse tendon disorders. So once again, the more we know about tendon structure, we can see the likelihood why some of these conditions might happen in one place more than another. Now, to contrast that, let's look at some tendons that have chronic overuse tendon disorders a lot. Something like the tendons from the common extensor group on the back side of the forearm here. So we'll zero in on this. This is, of course, the common extensor tendons right here. They sort of blend together right at this attachment on the lateral epicondyle of the humerus. These are some of the most common locations for tendons to have complaints from chronic overuse. That's because of the repetitive motions engaged by these forearm extensor muscles, and these tendons are relatively small compared to the size of these muscles and the type of forces generated during the repetitive motions. So that constant pulling on those tendon attachment sites overloads those tendons and leads to the chronic overuse tendon pathology in there. So these are some of the most common places that we see tendinosis or tendinitis complaints. But again, most of those complaints are going to be more along the lines of the chronic degenerative process in that collagen structure of the tendon and not necessarily tendon fiber tearing. Now, what about tenosynovitis? We mentioned earlier that tenosynovitis is a condition that only occurs in situations where you have tendons enclosed in a synovial sheath. Most tendons in the body aren't enclosed in a synovial sheath. The reason that sheath exists is it's designed to help reduce friction between the tendon and surrounding tissues that might cause additional friction and irritate that tendon. So let's look here. If one of the most common examples of synovial sheaths are those that occur in the distal extremities. So let's take a look here. We're looking at the wrist, and we're seeing the flexor tendons as they're coming into the wrist and going underneath this connective tissue structure here called the flexor retinaculum. If those tendons were just going underneath the flexor retinaculum, because of the constant bending of your hand, there would be a lot of friction of those tendons against that very dense fibrous structure, and that could lead to tendon injury. So those tendons are enclosed in a synovial sheath, and basically they slide back and forth inside that sheath, and that sheath helps reduce friction between the tendon and that surrounding tissue that's around those tendons. So this is a place where you might get tenosynovitis, because tenosynovitis involves an inflammatory reaction with some adhesions that often develop between the tendon and that surrounding synovial sheath as a result of the inflammatory actions in there. So we see those tendon sheaths most commonly in the distal extremities. You'll see them in the hand and the foot and ankle region, but there's a couple other places that we might periodically run into them. Like, let's come up here for just a moment, take a few layers off here, and we can see our friend zoom back in on the shoulder. We can see the synovial sheath right here from the biceps tendon. Let's put that biceps tendon back on here. Here's the biceps tendon, and notice that it takes a right angle turn. You can't see it right here, but let's actually just isolate that biceps tendon by itself for just a second. Now we can see how that takes a right angle turn across the top of the humerus right here, and that right angle turn across the top of the humerus makes a lot of friction for that tendon as it rubs across the top of the humeral head. So to prevent that, it's enclosed in this synovial sheath here, and so that particular tendon would be susceptible to tenosynovitis in that particular area as well. So these are the three main types of tendon pathologies that we run across. Interestingly, we treat them all pretty similarly. We've found that it's important to reduce hypertonicity or tightness in the affected muscles. So if you have a tendon that looks like it's got an overuse pathology, it's really beneficial to treat the muscle associated with that tendon to reduce tightness in that muscle. And then we've, for many years, treated those tendons with techniques like deep friction massage, which is going back and forth across the tendon fibers or rubbing with some pretty vigorous pressure directly on the tendon. That's kind of uncomfortable, but we found that there's some benefits to doing that. There is some research that suggests that that pressure and movement and the back and forth movement on those tendon fibers may encourage fibroblast activity that helps heal the damaged tissue of that sort of collagen breakdown process. So there's some clear benefits in performing that friction technique in the healing process of getting that tendon back into optimum health. There is also some suggestion, and we don't have a lot of research on this yet, but there is some suggestion that the friction techniques applied in a tenosynovitis complaint might be beneficial in helping break up or reduce adhesions between the tendon and that surrounding synovial sheath. So that's a beneficial effect of getting that tendon mobile within the sheath, once again, in a tenosynovitis complaint. So key things to remember here: focus on the muscles that are associated with those tendons, do some work directly on the tendons themselves, but a lot of tendon pathologies are also going to be most effectively managed with a progressive loading process that gets some load off the tendon during the time when it's really damaged or in more significant pain, but then gradually building up some degree of conditioning of that tendon so it can learn to withstand those forces that it's going to be exposed to later on. So that's a basic overview on common tendon pathologies. You can learn lots more about these tendon pathologies, how to identify them, and also how to treat them in numerous parts of the body in our orthopedic medical massage courses. And so come over and take a look at those over on our site at academyofclinicalmassage.com. Be sure to like and subscribe to our videos to keep up with all kinds of other new and interesting topics that we'll address on orthopedic massage applications to help get your clients out of pain. We'll see you in the next video.